Nearly 1,500 new cases confirmed across the country. And again, according to the expert data, the surge is largely being driven by younger Canadians. Let's look at the most recent public health data. Individuals under the age of 40 make up the largest portion of cases, pretty close to 2/3. 17% are under 20 years of age, 29% are between 20 and 29, and then 18% are from 30 to 39. So why is this ongoing? Messaging matters. How better to have effective messaging to the demographic in which the greatest number of cases are presenting? This morning, we have Robert Soroka, who's with us, a marketing professor with Concordia University's John Molson School of Business in Montreal. Good morning, Professor. Thank you for being our guest.
Good morning. My pleasure.
I mean, those numbers are pretty striking, and they've been the case for some time now. 2/3 approx of new cases under the age of 40. From a messaging perspective, Professor, where and why are we losing that demographic?
Well, there are many reasons why that demographic is not going to respond to the current messaging. First of all, you have to find the right platform. And the platforms that these demographics are using, typically Instagram, YouTube, those aren't the ones that are being used so well. The other thing is that you need somebody who will speak to these people, somebody who they will respond to. And at the end of the day, the spokespeople that have been used up until now are not really those that are geared toward reaching the demographics that are where the numbers are now growing.
So the platform matters, the messenger matters. Let's listen to a couple of those messengers, and I'm interested in your take. The other day, we had Canada's top doctor, Dr. Theresa Tam, making a direct call out to the young people of the country, and I thought she used pretty colloquial language. Let's listen to what she said.
We won't get COVID-19 back on the slow burn track without your help. This is your generation. This is your time. You've got this. Let's work together and own this pandemic.
So you've got this, let's own this pandemic. What do you think of her call?
It was painfully contrived, and at the end of the day, it's not just saying the right words. It has to be real, and it's not coming from Dr. Tam. She's an expert in her area, but this is not the person that the generation that is acquiring in great numbers COVID. They're not listening to Dr. Tam, and they're certainly not going to respond to a message that sounds as if it was put together in a contrived manner.
So what about the Quebec government? Let's listen to them next. They have released a series of testimonials. Here's an example of one of them, Professor.
Grosse fièvre, fatigue, la difficulté à respirer, jusqu'à peu être capable de respirer.
So that's Francois telling his story, trying to put a human face on the deadly virus. How effective is that, Professor?
Well, that's what we call a fear appeal technique. And fear appeals are sometimes effective if used the right way, not this time. Because if you're reaching the younger demographic, even though COVID is affecting everybody, it doesn't affect everybody in the same way. The 20-something, 30-something group, the teenage group, they're not going to see that advertisement and say, yeah, that's me. They're not. And at the end of the day, when you have a fear appeal, either you're going to distort the message or you're going to reject the message if you don't see it as being something that is consistent with who you are and what you're about.
Okay.
We're not, yeah.
Well, so I was just going to say, contrived doesn't work in your view. Fear doesn't work. What about celebrity? This is a little clip from something we saw originating in the United States. Actor Paul Rudd trying, humor, trying rap. Here's some of what he put out, and it became viral.
So fam, let's real talk. Masks? They're totally beast. So slide that into your DMs and twitch it. I wear my mask, and it's all I ask that you wear your mask. Please wear your mask. Just wear a mask. Just wear a mask. It's easy. It's simple.
And that's
Please.
Kind of how
it's
it
not
ends.
hard.
He did a whole preamble up to that strong message. His approach, Professor?
I think it hits the right note. You're talking about good source credibility. You're talking about a young fellow who is able to speak in a manner that is not so contrived. It's more consistent with who he is and what he's about, and it's going to reach that younger demographic in a humorous yet effective way. The fear level is not too high. It's not going to stimulate the distortion of the message. I think it's in effect a very good communication platform, good message.
Okay, so build on that for us. I mean, that originated, as I said, with that American actor. What would be more effective here in Canada? And if we do have something, a little bit of tape of someone that you think might be sort of a model that we might be able to emulate. Tell us a little bit what we should be doing instead.
Well, let's get somebody who that the demographic we want to target, we want to reach, will actually listen to. Let's not try to contrive people who have no credibility with that younger demographic, and now have those people speak in a different language in a different way and basically say the same thing, and try fear techniques or what have you. It's not going to work. Let's get somebody who could speak at the same level and who has that credibility and be able to communicate that, look, this is what you have to do, this is why I'm doing it, this is why it's cool to do it, and move forward in that way. Use the platforms that the younger demographics are using, and really be genuine. The younger demographics are able to smell something that's not genuine very quickly. They're not going to respond to the fears that they're going to die because they don't think they are going to die.
The invincibility, that whole thing, the hardest to tame that aspect too. I'm just going to bring in some video of somebody called Sugar Sammy, who maybe people won't be familiar with, but is this somebody that you would say is someone that you would, underline as being someone to follow or to model?
Well, Sugar Sammy did some YouTube videos with Cardiogenics Medical Center in Montreal, and now this is the type of thing that you're marrying humor with a serious topic. It's a fellow that does have reach with a younger demographic, and yes, that would be a very acceptable platform, a very acceptable source to convey a message that would work with the younger demographic.
Okay. Just before I let you go, how important is clarity? It seems that we're getting from health officials in some instances gently asking us to, for example, reduce our social interactions, and then it kind of changes. And I think you hear from people, they're not exactly sure what to do. For this younger demographic, how important is it that it is very definite and very clear?
It has to be definite and it has to be cool, because right now a lot of the young people are basically blowing this off. You're not seeing the same level of social distancing at that age range as you are, say, in the older demographic. You want to get people in that age range who get it and who have some type of social standing and be able to convey, listen, this is what we do. It's all right to do it. You got to do it. And that will be more resonant than some of the other messages we're seeing up till now.
Really appreciate your expertise in all of this. It's obviously a key task for the health officials to reach the people who are recording these cases in more and more numbers. Thank you, Professor Soroka from Montreal and from Concordia University with us this morning.